Hello, today I'm going to give a patient teaching on congestive heart failure. With me is Mr. K, who has congestive heart failure. Mr. K, how are you today?
I'm good. I spoke to my doctor this week and he explained to me some of the causes and symptoms of congestive heart failure, but there's still a lot about the disease that I'm unfamiliar with.
First, it is important to know that congestive heart failure is not a disease in itself. It is a syndrome in which the heart is unable to pump an adequate supply of blood to meet the oxygen requirements of the tissues and organs in the body. Mr. K, in order to give you a better understanding of what congestive heart failure is, I am going to show you an animated video. This is a picture of a normal heart and a heart with an enlarged left ventricle. In a normal heart, blood is brought into the left atrium, down the ventricle, and pumped up the aorta into the body for distribution. In a heart failure, the weakening of the heart as a pump results in slow blood out of the heart to the rest of the body. This causes a backup of the blood in those chambers in the heart that are weakened, as well as the veins that are returned to the heart from the rest of the body. The pooling of blood in the veins leads to the congestion of the surrounding tissues and organs and the development of congestive symptoms such as leg or edema, nausea and bloating due to bowel edema, and shortness of breath due to lung edema. Heart failure also affects the kidney's ability to dispose of sodium and water. This retained water also increases swelling in the body's tissue, known as edema.
Can you explain to me some of the signs and symptoms of congestive heart failure?
Some of the signs and symptoms that Mr. K is already currently experiencing are fatigue and weakness, which is the earliest symptoms of congestive heart failure, shortness of breath with or without activity, rapid or irregular pulse, and swelling of legs, ankles, and feet. Other symptoms include difficulty breathing while laying flat, decreased urine output, unexplained or unintentional rapid weight gain, and distended of swollen neck veins. Everyone loses some blood pumping ability in our hearts as we age, but heart failure results from added stress of health conditions that either damage the heart or make it work too hard. Factors increase your risk for heart attack or stroke are smoking, being overweight, eating foods that are high in fat and cholesterol, and physical inactivity. It is important to know that congestive heart failure is a symptom of an underlying cardiovascular problem. The disease process is often identified as a result of symptoms of congestive heart failure. Some of the most common causes are coronary artery disease, heart attack, cardiomyopathy, which is diseased heart muscle, hypertension, also known as high blood pressure, heart valve abnormalities, usually aortic or mitral valves, and also heart arrhythmias.
What treatment should I expect?
First, any underlying event that precipitates the heart failure condition should be treated, such as physical exertion, extreme temperatures, strong emotions. Treatment of congestive heart failure may entail hospitalization, initiation or adjustment of medications, surgery, and lifestyle modifications.
What can I do to help myself?
Lifestyle changes are important in the treatment of congestive heart failure. They include dietary restriction of sodium, stop smoking, limiting the consumption of alcohol and fluids, exercise, and weight control. There are many therapeutic measures you can follow each day to help relieve and prevent the progression of congestive heart failure. Some of these are: regularly follow a doctor's prescribed exercise program. Do not exert yourself. Avoid significant physical labor and emotional stress. Avoid fatigue by planning rest periods. Avoid extremes in temperatures such as saunas. Take medication exactly as prescribed. Weigh yourself daily to detect increased fluid retention. Do this at the same time each day. A weight gain of 2 or more pounds a week should be reported immediately to your doctor. Familiarize yourself regularly with your blood pressure and your heart rate. Mr. K, it is important to know the signs and symptoms of congestive heart failure and immediately report all the symptoms to your doctor. It is also important to follow the physician's plan of care. I hope the information I provided has helped you understand congestive heart failure. Do not hesitate to call your doctor if you have any questions.
Thank you.
Thank you.